Professor Mohammed Hani to present his session, which will be on the implementation of online OSCE. Okay.
Thank you, Sarah. Thank you, Dr. Archana. Thank you, Stephen, for the excellent presentations. So I'm complementing the work of my colleague, Dr. Archana, and will present how did we implement this. As you can see in the picture, it is a complicated and very complex process where we are dealing with multiple stakeholders. We are dealing with students, we are dealing with assessors, we are dealing with IT personnel, and it needs a lot of, it's a process that it's depending totally on actually doing everything right. So what Dr. Archana mainly discussing was about the planning and the organization and trying to make it error-free. It takes a lot of effort to do this. So today our objectives are to describe some methods of suggested methods for online assessment of clinical competence, to demonstrate the process of our AGU online clinical assessment in a stepwise approach, to reflect on students and assessors' feedback. We collected their feedback and we will share it with you, to discuss possible advantages of this method. Just a reminder, assessment should be aligned with teaching. So you might, if you are going to choose a method for your online assessment of clinical competence, it should be aligned with the method of teaching that you have used. These are actually some suggestions. I shared this with our colleagues from India before, and I'm suggesting here that we might triangulate these three methods together. As you've seen in my colleague Stephen's presentation, we can assess some of the objectives related to clinical competence in the written exam. And this will respond to some of your questions about the OSCE stations. We didn't use any OSCE because the modern software allows you to examine, use pictures, use lab records, use x-rays, to ask students in MCQ, single best answer format about really clinical knowledge. So I would really encourage schools who are using electronic assessment of written exams to enrich their assessment for the clinical years with clinical questions to replace the usual OSCE. And we also might use the formative part to assess clinical competence. We've seen some really good expertise from multiple countries to use virtual scenarios and virtual videos to assess clinical reasoning and clinical decision-making management and approach to clinical cases. And then comes our part, which we are covering tonight, which is the online OSCE clinical assessment. This is a suggested framework about what aspects of the clinical skills that you might cover using each method. As you can see, the written assessment is might be limited to assess data interpretation and management, while the online OSCE actually can assess all aspects, maybe weak in assessing physical examination skills and professionalism. Physical examination skills can be used in like proxy methods, like using videos that's showing clinical examination done in a wrong manner, or clinical findings that students can hear or interpret. And this also can be used in other electronic written exams. You can use videos in the electronic written exams instead of the clinical, or in addition to the clinical STEM that you are using, to the clinical vignette. And at last, the online Viva structured oral exams, you can also assess history taking, data interpretation, management, and clinical acumen, communication, and professionalism for sure. So the idea is to triangulate, use more than one method to make the best outcome of using all methods. So by online OSCE here, we mean that we are conducting our usual objective structured clinical exam using either meeting application or learning management system. And as we've discussed, it can cover most of the clinical competence apart from the physical examination skills. I have conducted a webinar with Mahi and Asumina Fry Institute about like 5 weeks ago. And this, we've conducted a survey to the participants. 65 doctors responded to the survey, and this was the outcome of the survey. They think that online OSCE development of items is somewhat difficult. The effort needed to train assessors is very high. Technology challenges, it's very challenging, but it has an acceptable validity, acceptable reliability, and high educational impact. So, and this is for the video, objective structured video examination, formative assignment, and written assessment. So a mixture of those will be really feasible. And the online OSCE is not at all, despite the technical difficulties, is not at all a method that lacks validity or reliability according to the medical educators' perspectives here. So we started with some assumptions. We assumed that we need to develop shorter scenarios, and the scenarios will be role played either by the assessor himself or by a role player. When coming to experimenting this, actually we used scenarios of the same length. Consideration for physical distancing and safety of examiners and role players was a challenge. Innovation to reduce cheating and keep students busy. I've seen some of your questions in the chat, and I can tell you that yes, you need to innovate. And as Dr. Mona, Professor Mona was saying, we admit cohorts of students into the same exam and try to put each cohort in a room. We will come to the details of this in a few minutes. So we put each cohort in a different room and they will not mix up. And by this, we can use one question for two cohorts of students. Then we will, one set of questions, then we will need to change the set of questions. We had an assumption also that it cannot be performed at a wide scale as usual OSCE, but we might be mistaken. After actually experimenting this, we've come to a conclusion that we might test up to 40 students in an OSCE that consists of 10 stations, interactive stations. So if we are using 10 interactive stations, we might test up to 40 students in around 4.5 hours, including the breaks. So you can test a good number of students. For some specialties, they prefer to use Viva. We will come to this. And in some other specialties, they used a mix of role-playing or OSCEs and Viva. And there's always the idea about adding videos to the station in order to assess some physical examination skills. So as I told you before, either videos with wrong steps, wrong technique, or positive findings that you need the student to interpret. So what we are talking here about tonight is our end-of-rotation clinical exams. We had a group of students, year 6 students. We didn't know what to do, as most of the clinical school, medical schools all over the world, what to do, what are we going to wait? We have no, we had a lot of uncertainty. Are we going to wait? Should we postpone the exams? Should we examine them? How much of the exams or the clinical competence can be assessed using online OSCE? So we decided, the school decided to test the students, to examine the students, and we used 3 different methods of examination. Structured Viva exams, it was because I've seen too many questions about this. The structured Viva exams, it was used in the surgery end-of-rotation exam. We used 2 assessors and they were examining each student for 20 minutes. In this exam, we've managed to examine 40 students per day, around 40 students each day. For the OSCE exam, we had two variations. One with where the assessor role play the scenario, and the other variation was that we bring a role player and train the role player, and he role played the scenario for the student. So our design for the clinical assessment was mainly, we had some like choices. So we agreed that we bring the assessors and role players into campus while the students are at their home. As you know, that AGU is a regional university, and students are we have students from Saudi Arabia, Kuwait, Oman, and United Arab Emirates, as well as Bahrain. So we agreed that the assessors will be here, the role players will be in campus, and students will be at home. We were choosing between purchasing laptops and using or using our existing desktops, adding webcams and speakers. We agreed to purchase only webcams and speakers to our existing desktops. We also agreed that LAN has much more stable connection and more reliable compared to Wi-Fi. We searched the applications, the available applications, and we agreed to use Zoom because of the excellent breakout room function, which is the core of this adaptation. And we agreed that we will have an exam host, a coordinator who will coordinate moving assessors and students into and out from the breakout rooms. We agreed that IT support is essential for the success of this exam. And we agreed to the mechanism that I've told you about, that we can use the same set of questions for 2 cohorts of students. So this is our main design for our clinical assessment. So now I'm going to take you through the most interesting part this evening, which is a journey through our online clinical assessment. We will take it stepwise. So prior to the exam, the department, so if this is for example, I'm from family medicine. So if this is the family medicine exam, the family medicine department secretary will start preparing for the exam. She will start preparing for the rooms. She will start communicating with the assessors, communicating with the students, and sharing the exam instructions with the students, sharing the exam instructions with the assessors, and prepare the sitting here in campus. She has a checklist. We've developed this. When we began this, we had nothing written. And while we were conducting our mocks and experimenting and finding the unexpected problems that arise from this OSCE, like any other OSCE, it has all kinds of unexpected stuff that comes out. So based on our expertise, we developed a checklist for the department secretary to use prior to the exam. Then we come to the exam day. In the morning, we conduct briefing meeting with the IT personnel. So one of our most essential things that we've used is to use IT support, 1 IT personnel for each room. In the beginning, we had like 2 supporting 8 panels, 8 rooms, and it was not successful in our first MOOC. So what we needed to use one IT support per room or per panel. So what I do in the morning, that I meet with our IT people, explain to them the nature of the exam, what kind of exam is this, how many minutes are needed, are there any role players, is there any kind of for how long they will share the screens with the students. Then I log into Zoom and start the meeting, and they go into the panels along the corridor that Dr. Archana showed you, and they go into the computers and log into the meeting using the name of the panel, which is, it has a label on the door. So if this is panel 2, they will join the meeting and name themselves as panel 2. So now the meeting is open, is established, and the IT personnel are joined the meeting. For each exam, meeting means exam. So for each exam, we had this type of organization. We have a pre-exam room, which were developed later into 2 pre-exam rooms for ID identification. Then, for example, for this exam, we had 5 stations, 5 panels, A and B. So this was the family medicine exam. We had 2 stations for this end of rotation exam, and the 2 stations are replicated for 5 parallel sets. So we can examine 10 students at a time and admit another 10 students. So we examine 20 students using the same set of questions, which is in this example are 2 OSCE stations. Then we have the post-exam room where students are moved after they finish. So what we do is, these are our students, these are our panels. So once the student finishes, for example, it's 10-minute station. So after 10 minutes, I move the student from 1A to 1B, and I move student from 1B to 1A. And I move a student from 2A to 2B, and the student from 2B to 2A. After they finish the two stations for 20 minutes, I move all students to post-exam, and other 10 students will be already admitted to the 10 stations. This is how we managed the breakout rooms as actual OSCE stations. This is another important part where I go to the settings and start apply the settings, and I have a checklist also for the settings necessary for the exam. One of these settings is to prevent students from chatting with each other. One of the settings is to move participants into breakout rooms automatically without needing for their approval. So they find themselves moved from one room to another, and disable others, like allow participants to come back to the main room, enable waiting room, which is another important feature. Then our technical team, while I start this, our technical team, as I told you, initiate, start the computer in this room, which is an exam room. This is our technical support person, and this is an examiner. They get into the computer, they log into the meeting using the meeting ID, and ensure, test the microphone, test the camera, test the speaker, check that they can share the screen, and stay there for the whole exam to help the assessor if he faces any difficulty. Then after we get all the panels on board, we bring the assessors for a very important assessors briefing that we didn't have also in the beginning. So from the mocks, we learned that we need to bring the assessors. So the head of department is sitting here. He explains to the assessors what are the expectations from them at the level of the department. And myself and our colleague, Dr. Muhammad or Dr. Archana, we run an actual demonstration of an actual Zoom meeting here in the room using this smart screen to make the assessors familiar with what will be going on and what's expected from them regarding running the Zoom meeting, and when can they go for help of the IT personnel, or if they, for example, one of the things, and how are they going to, for example, if you have your student and you didn't hear the bell, don't start the exam until you hear the bell, like any other normal OSCE. Once you hear the other bell, please stop the exam and wait for the coordinator to move the student out of the room into another room. So they were receiving this demonstration, and they were explained what are the functions, what are the buttons that they can use, and the icons that they can use in the Zoom. One of these icons was recording. So we allow each panel to record the exam for quality assurance. It was an excellent function. One of the functions that they can use is asking for help. While they are in the breakout room, which is our virtual exam room, if they suspect that the student is talking to someone, any bizarre voices, or the student is not looking into the webcam, they can ask, they are suspecting that he's cheating, and they can ask for help, and we can send a faculty invigilator to investigate the situation, maybe ask the student to move the camera around, or ask the student about the bizarre voices in his room. So now, while I am in the assessor briefing room, my colleague, Dr. Archana, the co-host, was admitting the panels. These are excellent, amazing IT personnel, and we didn't have this much number of IT personnel, so we used our employees, and we trained them to become IT support persons for the sake of using what we have, or the resources that we have. So we test the sound, we test the video, the quality of the video, the quality of the picture, and we admit them into the proper panels. And the department secretary in this time, she is uploading the exam material into each computer. The first set of questions are being uploaded to the computers, to the desktops that we are using. And then when the assessors come out from the briefing, she guides them to the rooms. And she was one of the most essential things is to have a WhatsApp group for the cohorts of the students who are going into the exam. And on time, she sends the ID of the exam to the students in order to come into the waiting room. Now, assessors are briefed, questions are uploaded to the screens, and we are coming to the exam initiation. We are preparing the exam initiation. So the first thing is, again, we check the sound with the assessors, and we check the assessors can share screen and can unshare screen. Then after each assessor, we check that he can do this, we admit him into the breakout room or the virtual panel. Then we start admitting students into the waiting room. I will display this short video. Here I am assigning, as you can see, I am assigning panel 3B into room 3B. So I'm assigning the panel into the right panel into the corresponding room, panel 4A into the corresponding room, panel 4B into the corresponding room. And here are the assessors. I'm checking with this assessor that she can share her screen properly, and then admit her to the breakout room and start doing the same exercise with another assessor. These are also important, this display, here I am. These are the different assessors. It was the family medicine exam. And here you can see the role player. This is a role player, and this is the assessor. This is also a role player, and this is the assessor. This is also a role player, and this is the assessor. So this is how it looks from my side, from my end, before I admit them to the rooms. When they go to the rooms, they are on their own. And this is how it looks from, I would like to welcome Dr. Bashir. He's one of, and Dr. Khaldoon. They are examiners, and they are among the attendees. This is how it looks. This is the waiting room. We have here 23 students waiting. And these are the participants who are already admitted, who are the examiners. So I'm admitting the examiners, then I admit the students and distribute them into the rooms according to the schedule that we are having. So now I'm checking with this examiner that she can share the screen, and that the audio is clear, the video is clear. And now she will share the question from her screen. So this is the exam question, and she's good to go to the waiting, to the room. Now, examiners are inside the breakout rooms. We admit students into the pre-exam rooms. We, as Dr. Archana pointed, we have 2 pre-exam rooms. This is our colleague. She's having 6 students, and she's doing the ID check and asking them to rotate the camera and give them the final exam instructions. This is one part, then one very important part, which is the color sheet with all the pictures of the students, so she can know which student she is talking to, and checking their ID number and their webcam images. Now we are ready to start. Now students are in the pre-exam room. Assessors are in the rooms, in the virtual exam room. Now Dr. Archana and myself are using the same sheet, which is organized and labeled according to the panels, and we are admitting the students according to this sheet, and then we will shuffle the students according to the system that we are using. This is the most important part. And once the students start the exam, I send a broadcast message to the assessors from the breakout room panel. Start exam now, and they will hear a bell on the same time. They can start the exam. 2 minutes before ending the exam, I send a notification. It's visible to everybody, visible to students and assessors. So 2 minutes prior to the end. And by the end of the exam, I send another message, end exam now, and they hear the bell. They stop questioning the students or stop asking or stop role playing the student. Here again, we have a student, we have a role player, and we have an examiner sitting in the back and keeping the physical distancing and safety. They are wearing their mask, they are sitting apart from each other. And here we have also the invisible invigilator, our colleague, who they had a problem with the audio, and he came into the room to check that everything is okay. And in a lot of circumstances, we come and provide IT support if they are having connectivity problem or audio problem. So I'm rotating the students. And while the students are being examined, 15 or 30 minutes before they finish, this is the department secretary, this is Dr. Archan, and this is our colleague, Dr. Muhammad. They are the co-hosts. And now I am admitting the second group of students into the pre-exam room for ID check again, while the first cohort of students are being examined. So there is no chance that the students being examined contaminate or share the content of the exam with their colleagues, because their colleagues are going through the ID check. Finally, we exchanged cohorts. Students who finish the exams their exam are moved into the post-exam room with, here's our colleague, Dr. Mona, Vice Dean for Clinical Affairs. She's collecting their feedback in the post-exam room. And while they are, as Professor Mona was explaining, I think it's Professor Mona Sheikh, while these students are in the post-exam room, others are being admitted into the panels. We are using the same set of questions. After using the set of questions for 2 cohorts, we change the question. After we run this 2 cohorts of students, the exam secretary, we give 10 to 15 minutes break to the assessors. The department secretary goes around and change the questions. She delete the questions on the desktops and upload a new set of questions on the desktops, so we can run another 2 cohorts of students. This is interesting, the feedback from students. So as you can see, students were strongly agreeing that the exam they were clearly informed. The mocks prepared them well for the exams. There was efficient communication from the school administration and the students. The transition between the rooms was okay. Format of the online exam was acceptable to most of the students. The examiners and invigilators were professional. Exam materials were clear. Here we have some objections. And that this exam can assess clinical skills. We also needed their perspective about this. 102 out of 150 students think that they strongly agree that it can assess clinical skills, and 110 had strongly agree that they were satisfied overall regarding the online clinical assessment. Whether these data are for the Viva, the simulated OSCE with the role player, and OSCE simulated with the examiner. Some of the feedback, what did you like best? Sitting relaxed at home instead of being stressed or waiting in Salmanaya Medical Complex corridor. This is very interesting. The organization from the beginning to the end was very, very smooth, and the issues brought up during the mock were resolved. This was a very positive comment. How smooth the process went, excellent choice. Doctors were asking specific questions, they stick to one objective, ease of the exam setting, support of all faculty members. The best thing about it, that it's recorded, they value this, and very comfortable. It was very organized and very similar to actual exam. 2-minute reminder before end of each station was very helpful. This is of course a sample of their feedback. I also generated this word cloud. As you can see, the most repeated words are smooth, everything is good, organized, home, stressful, it was less stressful, doctors, comfortable. So students are having a really positive feedback about this kind of exam. Okay, what did they dislike? Voice issues. Role player, they can hear the role player, but they cannot hear the examiner who is sitting in the back because of the physical distancing. This is an issue. Lack of privacy, they disliked, some of them disliked being asked to rotate the camera around their rooms while their colleagues are sitting there, and they have the right to dislike this. I cannot do physical examination. It is easy and it helps in our marks. So they are missing the physical examination part. There was a delay. They also complained of being held until the first cohort finishes their exam. So they didn't like this. This stressed me out more than clinical hospital exam. This was the point of view of some of the students. Extra time makes you feel bad after being done with history. By this, they mean that the station was too short, and or they finished too early, and they feel that they have not done good enough. The questions were hard. We didn't participate in clinical practice, and I guess they expected a bit too much from us. It's also a rational concern. Suggestions for improvement, nothing. Thank you so much, AGU, for all this hard work. I really appreciate what you all doing during this difficult time of Corona crisis. Make them easier and superficial, please. Showing the question all the time, because assessors used to share questions and then remove, stop sharing the screen after a minute. So students are requiring these questions to be displayed for a longer time. Improving the pictures, it was a common complaint in some of the exams, the quality of the pictures. Simulated scenario like the one taken in simulation center would be far more easier for both students and examiners. Equality in case selection, they thought that some cases were more difficult than others. Time not adjusted in a proper way. These are their suggestions for improvement. As for the assessors' feedback, most of the assessors were also they accepted the exam very well regarding, they were clearly informed, mocks prepared them well, efficient communication from our side, being helpful, briefing. They think that the briefing conducted before the exam was helpful, technical support adequate, they liked the technical support, they didn't like physical distancing that much, a lot of objections here. Exam duration for some was too long, exam material was not satisfying that much, but for overall, of course, it's to the right side. Exam reflects real practice, moderate agreement, proper sampling from the curriculum, also moderate agreement. Evaluation form structure is efficient. They agreed that the evaluation form used was good. Exam can assess clinical competence. Here we find some moderate agreement also. Overall satisfaction, most of them were satisfied with the outcomes of the exam. Another word cloud, organization, support, IT support, useful, mocks, real, preparation were the most common words. Recommendations from our assessors: use another venue, use more clinical stations, train tutors on computer technology. They felt that they don't have enough training. Practice the role player prior the day of the exam and assess performance of each role player before the actual exam. More role player training. Having similar sessions during the training. More pictures, labs, and lab results and X-ray. Physical examination using videos. Develop a better place with the geographical setting, maybe cubicle or specific rooms. We've studied this and we decided to use offices for multiple reasons. Add a short video again, more clinical questions to evaluate. These were the recommendations from our examiners. Now we are planning for our MD exit exam. We will we will have 2 meetings. We will examine 10 students per meeting. So in each, for each set of questions, we will examine 20 students, and then we will admit another 20. So for each set of questions, we will examine 40 students. And this will take, like I was telling you, 4.5 hours. Then we use another set of questions in the next, using the same methodology, but now each student will be examined for 10 stations. The maximum number of stations we've examined them so far in the end-of-rotation exams was 4 stations in the psychiatry specialty. They were examined for 4 stations. Each station was 7.5 minutes. So after being through this, and I had a lot of experience in traditional OSCE. What about online OSCE? I personally, these are my reflections. It has using this method, it can help us to manage student movement in an easier way. Very accurate time control. The ability to use videos and other high quality media is there. The exam is video recorded, which is a very good thing. It's valid for future practice, and the telemedicine. Telemedicine can be part of our, it apparently will be part of our clinical practice, and we are examining the students in the same way. This provides more safety for all parties, and it is less stressful for most of the students, not for some of the students. What are the lessons learned? Easier is always better. Always test assumptions. Don't assume that, for example, that assessors can share and stop sharing the screen, for example. Frequent training and updating for all persons who are involved in the exam. Communicate prior, during, and after the exam to improve. Always improve. Efficient use of resources is very important. Be open to learn and to improve from mocking. Support your core team who is conducting the planning, the training, the capacity building, and the execution of the exam. This is a preprint that we've developed. Tips to conduct virtual clinical assessment. You can scan this QR code or use this DOI to access our preprint. It will be published soon, inshallah. Thank you very much. And now we are ready for your questions. Thank you very much.
Okay, sorry. Okay, so thank you very much, Professor Hani. Now we will take a few minutes for discussion and questions that were directed for both you and Dr. Archana. We will start with the first question. Okay, we had a participant asking that, did you use real patients or simulated patients for the OSCE?
Simulated.
Okay, what is the, okay, and the next question was, what skills were assessed in OSCE?
Okay, we've assessed history taking, interpretation of data, management, decision making, communication skills.
Okay, what was the device used for input?
I need more clarification on this. Stephen, can you help me with this? What was the device used for input? I don't know. If okay, she can ask again.
Please, if you can forward your question one more time. Also, we had a participant asking that, what if one student faced internet problem during the second station?
Yeah. It's we have, like Dr. Archana described, we have an incident reporting. So if the student, we thought about the possibilities. So we had like agreement from the college council about the different scenarios that might happen. If the student lost connection early in the exam and can rejoin, he will continue. He will resume the exam. If it's like, if it's in the first 1 or 2 minutes of a 10 minutes exam, if he rejoined, he can resume. If the student is performed 75% of the exam, no need to rejoin. The grade will be, he will be graded for the part that he conducted.
Okay.
Otherwise, we have other, if the student has like lost connection, we might have an report the incident and take a proper action that it's, for example, for one of the students, we kept her for a different cohort of students. So we added her and we re-examined her from the start because she lost connection completely. So we will take the action according to the situation.
Okay. Okay, we have here also Ms. Hiba asking if we can share the kinds of questions that we asked in the online OSCE.
Okay, there is no need. We've actually used the same type of questions used in the usual OSCE. Nothing was changed.
Okay, so we had a similar question in which they were also asking about how did you assess motor skills?
We couldn't. For this time, we didn't assess physical examination skills or motor skills yet.
Okay, I think that's it for now. And thank you very much, Professor Muhammad and Dr. Archana, for your valued input.
You're most welcome.
Yeah, thank you, Sarah. Thank you.
Thank you. Okay, now last but not